सो हाय एवरीवन एंड वेलकम टू दिस न्यू पॉडकास्ट। आज हमारे साथ एक बहुत ही स्पेशल गेस्ट है। ही इज़ न्यूरोसर्जन इन गोंदिया डिस्ट्रिक्ट, डॉक्टर वैभव नासरे सर। सो वेलकम सर।
Hi Shivam, hi.
एंड थैंक यू फॉर गिविंग मी दिस चांस।
No problem, I'm always there.
ओके, तो सर आपका यूजी और पीजी कॉलेज कहाँ से हुआ था?
मेरा यूजी अहमद नगर के प्रवरा मेडिकल कॉलेज से हुआ है. आई एम वेरी प्राउड ऑफ दैट कॉलेज. आई लव दैट कॉलेज. एंड या नहीं, सेकेंड मेरा फिर उसके बाद सावंगी वर्धा में से एमएस जनरल सर्जरी हुआ है. देन एक साल मैंने एज अ एसोसिएट प्रोफेसर काम किया, साथ में प्रिपेयर किया. तो फिर मैंने कुछ 3-4 महीने का ब्रेक लिया और न्यूरो सर्जरी के लिए प्रिपेयर कर रहा था. उसी टाइम मेरा डीएनबी में रैंक लग गया और मैंने डीएनबी सुपर स्पेशलिटी तमिलनाडु कोयम्बतूर में लिया. और एक साल मैंने एम्स रायपुर में भी उसके बाद काम किया है. एंड देन आई स्टार्टेड माय प्रैक्टिस एट गोंदिया.
अच्छा, तो सर आपकी प्रैक्टिस कितने साल से चल रही है?
So as an independent neurosurgeon, I'm practicing since 3.5 years.
अच्छा सर, तो बात करते हैं आपकी यूजी लाइफ कैसी थी, मतलब कौन सी ईयर की बैच थी और उस समय
Okay.
क्या चल रहा था?
So I started in 2006, finished in 2011. It was a wonderful journey. हमारा कॉलेज बहुत isolated, little bit isolated place में था और शिरडी के एकदम पास में था. So कैंपस के सिवाय हमारा कोई लाइफ नहीं था. We used to love our campus. It was used to be full of full of young enthusiastic crowd. हमारा दो ही लाइफ था. It was like 4 घंटा लाइब्रेरी में जाओ, 2 घंटा ग्राउंड पे जाके खेलो, फिर लाइब्रेरी जाओ, फिर टेबल टेनिस हॉस्टल में खेलो. So it was all about library and some sports there, and we used to enjoy our cultural festival and everything. We had a great time there. But everybody was motivated for their studies. The whole library used to be full. I think the library would be, it was so huge that 1,000 people could sit there. It was so huge.
So sir, how did you decided to go into surgery specially?
See, when you study during your MBBS days, the book you pick up the most is the subject what you like. So whenever I felt like studying in library any time, I always wanted to open the book of general surgery and read as much as possible. And the enthusiasm I used to get after reading that book was like amazing, which I never used to get from other branches books. So that kicked me, and one of my friend's father, I visited Dr. Vijay Raghoji at Solapur. So looking at his hospital, his way of talking, his humble nature, he was a super specialist that time, way back in 2008 I think. So that inspired me to become a surgeon.
And sir, why did you choose general surgery? I mean, how did you fall in love with general surgery?
Yeah, it was
neurosurgery.
Yeah. So during my general surgery training, I happened to have a neurosurgery posting of 2 months. So during that neurosurgery 2 months, it all changed my life. I was never inclined toward laparoscopic surgery or minimal invasive surgery. That second year hit me in my brain that I want to do only neurosurgery. The boss under whom I worked was Dr. Sandeep Redvar sir. He practices at Nagpur. He is my guru. Because of him only I became a neurosurgeon. He inspired me. That kick in the second year of general surgery, that after doing surgery you are saving a life of a patient. And I did not understand anything much about neurosurgery during general surgery days. But that 2 months of enthusiastic work at neurosurgery changed my life. In fact, after giving general surgery exam, within 7 days, I worked within 7 days, when the results were not out, I immediately joined neurosurgery department. I was so enthusiastic to work in the neurosurgery department. So that he inspired me to do, and after that I got neurosurgery, and all my teachers during neurosurgery, they inspired me more, and 2019 I became a neurosurgeon.
Sir, if you are not a surgeon, what was your second top priority?
Definitely a sports person. I am a great sports fan. I love sports. I'm not going to boast about myself, but yeah, I play a lot of sport. I play great table tennis, cricket, all rounder. I'm in cricket. Whatever sports you say, I have played already. In fact, golf, squash, everything.
So, sir, let's talk about your daily routine, average day. So, what does your average day looks like? Means, how much time do you give to OR and OPD?
Actually, you cannot. It's not a institute. Institute has a proper routine. There will be daily elective cases or emergencies will be handled by postgraduates. But here, I am the only person. I am the department. I have to admit the patients. I have to discharge the patients. I have to operate. I have to take care of ICU. I have to look after emergencies. I have to be 24 hours available. So my routine is not fixed. So it's like morning I get up, come to hospital, take ICU rounds, make sure my ICU patients who are little critical are okay, and immediately after starting I can see my OPD. If I have planned any elective surgery, I go to elective surgery. Elective surgery will be, say for example, spine 1.5 hours, brain 3 hours, then evening 3 p.m. 4 p.m. I sometimes plan afternoon surgeries also, if it's a spine, if it's a superficial brain tumor or something. Then if any patient is admitted in the night and it needs surgery, I try to electively ventilate the patient so that brain edema comes down, and early morning 6 a.m. sometimes I take surgery. That happens a lot of times with me, so that it does not disturb my whole day. Evening, again OPD, discharge the patients. Night, it's all daily. Some emergencies will come in my hospital, in some other hospital I'll get a call. So head injury, strokes are so common that we have to take care 24 hours to them. We cannot say that we are not available. Any stroke, any head injury, you should not ignore. You should always see the scans, decide according to them. Always see the Glasgow Coma scale, which decides the treatment of the patient. Scans tell you everything. Pupils and GCS are very important. So this is my life throughout the day.
Sir, how many average patients do you see per day?
It depends. My practice is more of super speciality practice. So surgical super speciality practice patient. Monday and Saturday it will be like around 30, 35, 40 patients. OPD I am saying. IPD will be different. And routine days would be around 20, 25 patients.
So most.
But I give time to my patients. It's not like I see, I write medicines and I send. I try to do proper counseling and give as much as time, answer all the questions, whatever the family is asking, and satisfy them.
Most amount of patients you are seeing per day?
It would be around 40. I cannot see more than 40. I have always headache after 40.
Okay, so sir, average working hours per day and how much sleep you get?
Sleep is very indefinite, but during neurosurgery training, we are we become so strong that even if we don't sleep for say 2 days continuously, it's not a problem. You get 1 hour in between, you can sleep for 1 hour and then start working. It happened a hell lot of times during neurosurgery days. And here now also sometimes it happens that I operate, it's 3-4 hours, then it's already 2 a.m., 3 a.m. or sometimes the patient come at 12 a.m. or 1 a.m. I have to operate, 2 a.m. I have to operate, the surgery gets over by 6 a.m. The day starts, I don't sleep. So afternoon you can get a 1 hour nap. And this is how it works. Neurosurgery is a emergency branch, is a life-saving branch. You cannot wait. You cannot say that we will wait and we will see. You have to take decisions faster. You have to explain to the family that I am doing everything for saving the life of the patient. At the same time, give time to the family. The Counseling is the most important in neurosurgery.
So, sir, what's your favorite thing to do after work?
Yeah, play sports.
You
I
still,
miss that a lot actually.
you still play sports
Yeah,
these days?
trying to play table tennis on and off sometimes. But recently I've developed a hobby in gym. It's been 3.5 months I'm doing gymming. Um, so I'm loving all form of sports are lovely, and you should have one hobby. Sports is a great thing to enjoy. It decreases your stress. It helps you motivate your mood, and it gives a positive energy. Sports is must for every doctor. Sports is must to relieve the stress.
So, sir, does every neurosurgeon's life looks like this?
No, there are busier neurosurgeons than me. Probably when I have a practice of 10 years or 15 years, probably I'll be busy like them also, with the grace of God. But there are busier neurosurgeons who are seniors. They have elective cases daily. They have many assistants under them who will do emergency care. Uh, who will do, say for example, I have a assistant neurosurgeon under me and he's looking after all the emergencies. I am looking after all the elective neurosurgery. This is how it works. You cannot a whole life it won't be able to give a emergency care. Daily night I am waking up, and it 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 has an effect on your health. I feel I might be wrong. People may have some different opinions, but I feel that there are busier neurosurgeons than me. But when you become very 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 busy, then you take help of your colleagues. You can have one more colleague with you to work, and then this is how you try to balance. Then one will look after emergency, one will look after elective, and this is how it works.
Sir, how much time do you get to spend with your family?
I cannot answer this question much, but whenever I get time, I try to give it to family. Whenever, it's the most priority thing for me.
And how often do you get holiday?
Yeah, I make sure I go to holiday with my family. I've been to 7 countries by this time. So every 3-6 months we try to go to some other country. India I will roam when I am a little old, but I am trying my level best that whenever I get time we explore, me, my wife, my kid. We explore a new country, see new culture, meet new people, and we love it.
So, sir, what are some common misconceptions do people have about neurosurgery?
That the patient, you operate and the patient never becomes a normal human being like he was before. It is a wrong concept. And patient has, they are very worried about spine surgeries that some doctor will operate and they will never be able to walk properly. That's a misconception for brain and spine both.
Among all the neurosurgeries, what's the hardest procedure that you do?
I've done few CP angle tumors, cerebropontine angle tumors. I think skull base surgery is one of the challenging surgeries when the tumors and all the other space occupying lesions are near brain stem. So brain stem is the most vital part of our brain. Any tumor which is located near brainstem is a difficult job to do. I've done few and I've succeeded nicely. I've removed the whole tumor. My patients are good. I've done few aneurysmal rupture clippings. I've done DACA aneurysm clipping. I've done ICA bifurcation aneurysm clipping. So I'm enjoying. I love to do skull base. Not into too much of endoscopic brain surgeries. I love to do aneurysm clippings. I love that. These two surgeries are favorite of mine.
And sir, what is the most common procedure that you get to operate?
It's trauma, decompressive craniectomy, and all the strokes, bleeds, basal ganglia bleed evacuation, and all that.
And what's the most memorable?
And spine also. I do a hell lot of lumbar spine. I do a lot of cervical spine, and I have a good results also.
What's the most memorable case that you have encountered so far?
Memorable case. Maybe I can tell you about the recent times. A young chap came to me in comatose state. There was a midline shift, bleed. I operated middle of the night. Patient became okay. After a few days, he deteriorated because of the hydrocephalus he developed. I did a shunt. Patient improved. Again after a few days, he deteriorated. I did ventricular peritoneal shunt on opposite side and cranioplasty on the same side of the decompressive craniectomy. So there are two shunts and one cranioplasty area. So already 4 surgeries plus tracheostomy. 5 surgeries has been done. Then patient improved, then deteriorated after a few days. But family had faith on me somehow. They roamed everywhere. They took a hell lot of opinions, 5 opinions, 7 opinions, 10 opinions. None of the doctors said bad about me or that I'm doing this could have been done and this is the wrong way and this is the right way. Everybody agreed to my decision making, and patient was little bit of exhausted because of money. So through me, they went to a government hospital. One of the doctors there, we had a discussion what can be done. Again, the shunt was removed, the CSF was let out, patient improved. For 5 consecutive days, CSF was sent, which was culture negative. There was no infection in his brain. And then they revised the shunt at government hospital. Constantly, the family was talking to me. And so after 7 surgeries, patient came to my OPD walking and he said, I'm alright, sir. And he has no deficits. He's absolutely fine. He's walking. He's using his both upper limb and lower limb properly. He's identifying all the family members. So this is a myth. 7 brain surgeries, patient is walking. So you have to believe the doctors, what doctors are saying.
Sir, what is the toughest part of your job?
Families counseling. When the patient is comatose, it is very difficult to tell the family that patient is going to take time and he is going to take few days or maybe 10 to 15 days to wake up or identify you. That is the toughest job I feel in my branch.
And what is the most rewarding part of your job?
When I save a life, they go home happily and they come to my OPD after few months and they start recognizing me because when they are comatose, they don't recognize me, who am I. But when they come to OPD in regular follow-ups, they start recognizing me and the whole family tells them that I have saved their life. So that's the most rewarding thing in my branch, I feel.
Sir, can we ask how much does neurosurgeon earn per month?
That's not the question to be answered publicly because everybody will have a different opinion. So you can say in a government medical college, in a private medical college, government medical college salary will be decided on what post you are. Whether you are a senior resident, lecturer, associate professor. Central government professors, they have I think 2.5 to 3 lakhs also. Neurosurgery in private practice, it depends on where do you settle down. I think it's hell lot of competition. You cannot say that even after doing neurosurgery, super speciality, you're going to earn a lot of money. It's a lot of competition, a lot of people are coming. So you have to struggle, you have to work hard, you have to be available 24 hours. But yes, you get a handsome salary, no problem at all.
So, sir, what's your favorite music to listen in the OR?
I don't know, I love Arijit Singh, I love Sonu Nigam, I love Linkin Park, old MBBS days songs, Linkin Park and then Enrique Iglesias.
So,
I love those college days songs. But I love listening to music while doing surgery.
Isn't it disturbing?
No, 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 no. So whenever there is a crucial step, I always tell them to stop the music. And any regular surgeries, I have no problem listening to music, and it's always on a low volume.
Sir, how did you change yourself from your UG days to PG days and then super specialty? So, like, how was your approach? How did your approach change in this way?
No, the only approach was not to settle anywhere. You have to just keep learning as much as possible. And there was always in my head that to become the highest authority in your branch, that I want to be the highest authority in my field. So I wanted to do super specialty, and neurosurgery came because of my boss during general surgery, that I want to do this.
So, sir, how has the field of surgery changed in your career? When you were doing MBBS, then you went for general surgery. Now you are doing neurosurgery. So, like instruments and all.
Yeah, general surgery is all about using your hands and using your good suturing techniques in the abdomen. But neurosurgery is not like that. Neurosurgery is all about using your suction and bipolar. So how beautifully you use your micro instruments, your bipolar and your suction. You don't touch anywhere. If you touch, you will have an infection. So the first thing is taught to us is not touch with your hands anywhere. The only thing you can touch is your suction, your bipolar and your micro instruments. So this is how it goes. It changed, and that's why neurosurgeons always say you should become a neurosurgeon with a 6 years training. 3 years general surgery, 3 years neurosurgery is not like that. If you go to US, UK, it's a 7 years journey of neurosurgery after your medical school.
So, sir, what are the recent advancements or changes in neurosurgery that you find exciting, like use of artificial intelligence, robotics, and neurosurgery? So, how is the field is evolving?
Okay, robotics, as far I have heard, that it's a failure because of the brain shift. So even our robot plans that he is here because of the let out of the CSF, the brain shifts. So whatever the robot might be thinking, it is not happening there. So navigation is one good thing. Navigation is what we use in our car for simplifying things. I'm telling you like this. If you navigate, you put a probe, the navigation probe will tell you the tumor is there. From where it's a football. So if you have to reach in the center of the football, you need to navigate. You cannot, destroy the fibers of the brain. You use the navigation. You use a small craniotomy to resect that tumor. Go there with a proper direction, and then you can resect the smallest tumor possible. And more technologies are coming that in spite the microscopes play a excellent game in neurosurgery. The neurosurgery is not done with naked eyes. We should always use a microscope. Microscope gives you 25 times, 40 times magnification and great illumination. So the cameras, the new things, exoscopes are coming in future. They are already, people are using that, but not much. Then navigation is great. Then advances are happening. Great advances are happening in neurosurgery. MRI is coming. They are saying 7 Tesla MRI is coming. Then tractography helps a lot. You can track the whole single nerve fiber of your brain and see whether during resection of the tumor whether you are going to touch this white fiber or not, or some other fiber. You can explain the family if this is damaged, then patient can have this deficit. Awake brain surgery is one great thing, where neurosurgeon's job is simple, but anesthetist job becomes a little difficult. When the patient is awake and you remove the tumor, can be done very easily. You need to have a very good neuroanesthetist for that.
So, sir, among all these advancements, do you think that AI still can't do this?
No, they can with the help of a doctor. See, if you have a robotics in general surgery or neurosurgery, It's not the robot who operates. It's the doctor who is sitting next to the robot, and the doctor is manipulating the robot and the robot is operating. It's a mother and child concept. It's not the robot who is operating, it's the doctor who is controlling the robot who is operating. So you have to have an understanding of this. So even if the neurosurgery has a robot, it will be a doctor who is controlling the robot and the robot is operating.
Sir, but do you think this means that telesurgery is not possible in neurosurgery?
It is possible, but still there has to be a neurosurgeon in the OR who is doing the surgery. Telesurgery is one doctor telling another doctor, say for example a very senior doctor telling a junior neurosurgeon do this, do that. But you cannot expect this. I don't think so. This is not my belief which is going to happen in near 50 years, I feel. Maybe after 100 years, I don't know. But 50 years, I feel this is not going to happen.
So,
I
sir,
may be wrong, I'm sorry.
sir, what do you prefer, doing conventional surgeries or using robotics?
See, neurosurgery is all about using gadgets, I feel. Robotics is not needed in the present era. If it comes, it is very good, but microscopes and do you have we have microscopes have a magnetic brakes. It's a robotic arm which we are using already. So it's a single button click and 400 kgs microscope we can move like this. So this is robotics, this is engineering. So, and we have navigations. With all these good gadgets, I don't feel the need of robot at all. We are already using amazing gadgets already.
So, how do you stay up to date with this recent advancement?
Now we have to do all the. We have to always go to national conferences. We have to listen people what people are doing, saying. This is how you upgrade yourself. You should keep reading your Neurology India articles, what seniors are doing. You should always, many seniors are making their YouTube channel. Yeah, they are posting their surgeries, how they are doing. You should upgrade yourself always by listening to what seniors are saying. This is how it goes. You should always have gurus in your life and you should listen to them, work like them, try to imitate them, understand what they are saying. Don't have arrogance that I am the god. This is stupidness. And so, lot of knowledge, lot of good listening, obedience, being obedient, makes a good surgeon. So I try to keep doing all the CMEs and conferences.
So, sir, if you could change one thing in our current medical system, what would that be?
That all the neurosurgery seats in India should be 6 years. One thing. I feel the education system is good only. The rectification is more, but I feel Indians are more intelligent than other countries, and there it makes a little difference because I may be wrong, but I feel that other countries it's an open book system as far as I heard, but in our country it's all you mug it up, you write it, you do all the objectives you have to click, multiple choice question and everything. The system is very nice, but the training, super specialty training has to be more. That's how you become polished. The more you train yourself, you become more polished. And there is one thing in other countries that under a proper guide, if the boy is performing a surgery, this particular surgery has to be performed by a postgraduate, or else the postgraduate will not be punished, the boss will be punished. Understood what I said?
Yes.
It is the duty of the boss that his boy is performing independent surgeries under his supervision for 50 times or 100 times. It is the duty of the boss. As far as I heard, the postgraduate can raise his voice, or not voice, I'm sorry, but he can go to higher authorities that I was not given a chance in OR, and which does not happen in our country.
Right.
In our country is only it's observe, assist, observe, assist, observe, assist, learn. When you become a third year, maybe you get a chance a lot of times, because third year is more intelligent. He understands what things to be done. But first year and second year, you read, observe, learn, observe, learn. Take care of emergencies. So our country is great. We are having a very good system, but I feel the postgraduate should get more chances.
Okay, sir. When there was COVID-19, so what was your practice in those days like?
I was not doing much. I was seeing some COVID patients. I tried to operate few patients, but they didn't turn up. Because of COVID, their score was very high. In lungs, there was a lot of infection. I operated few. Even if I operated, few survived, few died because of COVID. And during that time, I was thinking of, myself, I was thinking of making some gadget. I tried to find many mechanical engineers, this, that. In process, still not able to form that gadget.
Sir, what do you think? What are some qualities are very essential to become a good surgeon, good neurosurgeon, and how yourself you develop this?
Fast decision making, on toes 24 hours. You should love your job, you should have a passion for your job. Politeness is very important. You cannot be arrogant anytime in your life. You have to be humble and grounded. I feel this is very important. To improve your skills, you can. My boss used to say always, you should eat your food with your chopsticks to become a good neurosurgeon. So, yeah, that's the thing. Bipolar suction.
Sir, what challenges you have faced until now in your career?
Challenges, as in what challenges you're saying?
If you are not able to understand this topic or subject, so how do you face it?
No, go to seniors, talk to them. Sir, I'm not understanding this. You should be very transparent and vocal about it. Sir, I'm not understanding. Please help me. We can discuss. We should always have colleagues with you who will be there to help you. So discussion is the only thing which will solve your all the queries. It happens. There are a lot of things. So discussion, conferences, talking with your bosses, talking with your friends, colleagues, seniors helps you a lot.
Sir, why do you think someone should choose your branch?
You should have a passion. Your passion for your branch has to be there. So if you enjoy it, then only you should do it. If you don't enjoy it, then it's difficult to survive in neurosurgery. I heard the deaths and the divorce rates are very high in neurosurgery. I've heard that, I might be wrong also, but this is the truth. So, deaths means suicide, I'm saying. So, think about it, but if you enjoy, then not a problem at all.
Sir, that means whatever challenges there are in neurosurgery, your passion comes above that.
Yes, definitely. But if you have a balanced life, then you can,
Sir, what are some important lessons you have learned in your career till now, and how has those changed your approach to the patient care?
Being humble is the most important thing. You have to heal the family and the patient both. It's not the only patient you have to heal. You have to be very soft and gentle with the family's relative. Give time to the family. Just counsel them that he is going to take time for the recovery. If you counsel them properly, then things are on your court. Then if you don't counsel and the patient dies, then it's difficult. Elective neurosurgery, patient do well, but emergency surgery you have to counsel a lot.
And sir, how do you handle the poor outcomes in this?
I clearly tell the families that the patient is not going to survive. You can take the decisions.
Any research project that you have worked on?
Yeah, I've done a research on post-traumatic subdural hygromas that after doing decompressive craniectomy, how many patients are developing subdural hygromas, whether they need surgery, whether it can be conservatively managed, how many patient develop opposite side contralateral subdural hygroma. So I've done a research of 30 cases. It's being published.
Sir, did any of your patient die on the table?
Never it happened. It has happened after 7 days or 10 days post-operatively. When I knew, looking at the scans, this brain is very bad. It is going to bulge like anything. Angry looking brain, very tense, tight brain. But it never happened on table. Never ever. If this is going to happen, I'll tell the family that the surgery is not going to help the patient. They also understand. It happens when the pupils are dilated basically. So already brain dead, no gag reflex, no point operating surgery, no point operating. Old age. But some GCS is good. You should take all the efforts to save a life.
How do you cope up with the mental and physical stress that comes up with your job?
Go to gym, play sports, have
Meditation?
meditation. Yeah, definitely. Don't use your mobile. That's the worst thing anybody can have. It has increased the anxiety to 4 times, 10 times, I feel. And have time with family. That's the most calm and nice thing about our life. Play with your kid. I feel that is the most amazing thing in a doctor's busy life.
Sir, is being a neurosurgeon was everything you expected?
Yeah, I want to do more. Yeah, I'm not finished yet. 30 years more I have to practice neurosurgery. Maybe I'll do some more research, I'll do training, I'll do this. In my city, I'll try to bring all the facilities, navigation, deep brain stimulation, near future, spine endoscopy. Try my level best to improve myself every year, to do as much as I can for my people in my city and surrounding areas. I do neurointervention also. At this age, after finishing all the neurosurgery, after passing, after doing everything, after starting my private practice, I stopped my private practice for 1 month. I went to Delhi. I trained myself again. I learned neurointervention at GP Pant Delhi, and then started doing neurointervention at Gondia. I've done almost 50 digital subtraction angiography at my hospital. So neurosurgery is. Do you want to listen to neurosurgery things,
Yes,
or you
sir.
want to listen to other stuff?
No, sir.
More neurosurgery,
Yeah.
right? That's why you're taking my
Yes.
interview.
Yes, sir.
So neurosurgery is all about 33% preoperative care, 33% operative care, and 33% post-operative care. It is a 100% job. So preoperative, I'm talking about, say, emergency surgery first. So when the patient comes, if the patient is comatose, he aspirates, patient's ICP is raised, his BP will be shooted up, bradycardia, Cushing syndrome will be there. Cushing's triad will be there, I'm sorry. Then you have to give all the anti-edema measures possible, you have to sedate the patient, ventilate the patient, put the patient on ventilator, intubate. There are many centers in the country where neuro ICU is taken care by neurosurgeons. This is a myth that ICU is taken care by only non-neuro doctors. This is a myth. There are many centers in the country where neuro ICU is taken care by only neurosurgeons, and intubation, elective ventilation, ABGs reading, post-operative care, pre-operative care, everything is done by neuro residents, neuro doctors, senior neuro doctors, everything. But there is no harm in taking care of your health, who are intensivists, great intensivists, working 24 hours, taking care of patients in a better way. So you can always have your good team. The team matters a lot. So when the patient comes, intubate, ventilate, decrease intracranial pressure. If the patient needs surgery, shift the patient for OR, CT scans, MRI scans, whatever are needed. Then surgery is one job. During surgery, the brain should not bulge. Brain should settle nicely. CSF should be let out. Bleeds and everything should be decreased. Post-operatively, you have to sedate the patient properly so that the blood pressure is not increasing. The patient should not have any kind of rebleeds. Post-operatively, again, you have to do scans whether there is no bleed, whether your surgery has done a great job or not. To see that, then you have to ventilate the patient, decrease the cerebral edema. When the patient becomes conscious, nicely, not fighting, doing well, then you can slowly extubate the patient. If the patient is not extubatable, you can do a tracheostomy. This is how it goes. Elective neurosurgeries are very nice. Generally, spine patients never have any trouble. Cervical cord contusions and all, they can have a breathing difficulty. They can go for tracheostomy and everything. Elective neurosurgery, yes, they do well. Brain tumors, superficial brain tumors. But in many elective surgeries, patient can be electively ventilated. Many neurosurgeries. Patient, they are electively ventilated to decrease the edema of the brain. You have to have a good balanced life, I feel. Don't be in a rat race. I don't like having a rat race. I'm not in competition with anyone. I'm in competition with myself. I want to improve. I will take more efforts to upgrade my knowledge, learn more skills, learn minimal invasive and do as much as possible. But I'm not in the rat race. I'm sorry to say this. Work hard, follow your passion, enjoy life at the same time. Give time to your family. That is the most important thing. To your parents, to your wife, to your kids. And respect all patients. Don't be arrogant with them. Enjoy everything.
Sir, at this point in your career, at this point in, or at any point in any doctor's career, do they still need to ask their colleagues or other specialty doctor they are practicing in other cities if you have any confusion about any cases? Does this still happen?
Yeah. I always discuss with my seniors who helped me train myself. Dr. Santanam, Dr. Lokesh. There are many doctors. I always discuss. There is no harm in discussing how should we plan. Because they also need me sometimes. That how can we do, what can be done, how many cases you have done this, what was the outcome, did you have any difficulty. Every doctor's journey is different and they can discuss. There is no harm in discussing. You always upgrade yourself by discussing things. And you should not have any shame in saying that I am discussing.
Sir, before choosing the neurosurgery, you must knew that there will be these challenges. You won't be able to give time to your family. The day will be so hectic. But how did you still choose this branch?
Because I love it. My wife also knows I love it. My mother also always cribs that you don't have time for me. But still, I love my job. That's why I'm doing it.
Didn't it occur at any point that you thought, should I take this branch or not?
No, it never happened. See, you cannot have regrets in the life. If you have decided something, you have to move on with it. You cannot have regrets in life. Enjoy, just enjoy. And if you are finding yourself too hectic, you can always take a break for a few days. No problem. Give time to family, give time to friends. Take a break. Start working. Start having motivation again after that break.
Sir, what advice would you give to a medical student if he wants to pursue neurosurgery?
From the start, from during first year MBBS, start learning neuroanatomy properly. We ignore that, I think. I hope I'm right. Neuroanatomy, you should know. When you start learning that neuroanatomy, you develop more interest in neurophysiology, neuromedicines. And during medicine, you should, CNS part, you should read more. It's very challenging, very nice. And others, what all things I can tell? I think I have told everything, all the things. Motivation is the most important thing. You look up to somebody. then you get motivated. This is how it happened to me. I looked up to my bosses who are doing neurosurgery. I found my passion looking at them. I loved what they did. That's how I inculcated in myself. And I treated them as my gods. That's why I could pursue neurosurgery, I feel. So you have to have passion, follow your seniors, bosses, read properly, and you should have a little bit of vision that the future is going to be difficult. It is going to be more of a very competitive world, very super specialty world. Super specialty will be everywhere. So I feel Tier 1, Tier 2 cities, super specialty is must. Tier 3 cities, you can settle with a good fellowship, but being an expert, that too being an expert. You have to enjoy ultimately whatever branch you take. Somebody will enjoy a plastic surgery, somebody will enjoy cardiac surgeries, where you get the most adrenaline rush, where you love it. Looking at the heart, or looking at the small pediatric intestine, or cosmetic plastic surgery, or a vascular surgery, doing anastomosis, whatever, where you feel your adrenaline rush, you keep yourself there, operating there, or in a say doing angioplasty, putting a stent, saving a life again, where your heart says that this is the branch for me, where you find your passion and joyness. You have to follow that path, that I'm going to be a cardiologist, I'm going to be a neurosurgeon, I'm going to be a plastic surgeon, I'm going to be a laparoscopic surgeon, I'm going to be an obesity specialist. You have to follow a path. If you follow one thing, then it's difficult. If you follow one thing, you will find everything easy. If you have multiple things in your mind, then things get difficult. Just follow one path. I had no other choices except I had during my times, the MCH cardiac surgery seats were vacant. I could have taken MCH cardiac surgery, but I got DNB neurosurgery. I didn't want to waste my time. I just took it. And I knew that after finishing the DNB neurosurgery, I will do some fellowships and work somewhere, and then start my journey as soon as possible. I didn't want to waste my time, like I will do only MCH surgery or anything like that. But that's an inspiring story, and I was so passionate that I got national gold medal in neurosurgery. DNB rank 1 in the whole country.
Wow.
That was a surprise for me also. But if you enjoy the subject, then things are very easy, as I said.
It was good to hear. So, on the scale of 1 to 10, how much are you satisfied with your job?
10 on 10, man. 1% I feel that I don't give much time to my family and friends. But it's 10 on 10 always. It's 10 on 10 always. I love my job. I love what I'm doing. I'm happy what I'm doing. I've built my hospital. I have everything, all the facilities in my hospital with my friends. So I'm happy, very happy. I don't get much time to play sports, that's one thing. But it's always 10 on 10 when it comes to my profession. I feel, but you should take out some time to travel the world, to take care of yourself, health, play sports, and give time to family.
Okay, sir, it was very nice talking to you, and whatever curiosity I had in my mind about neurosurgery, I think
Thanks, dear.
everything got solved.
Thank you.
Thank you, sir, for giving me this chance, and thank you everyone for watching this video. So if you like this video, please do subscribe to my channel. Also,
Thanks. Please subscribe to the channel.
no, sir himself has a channel.
Yeah, I have a channel.
Where he teaches about neurosurgery.
Yeah.
The link will be given in description. So thank you for everyone. Thank you everyone for watching this video, and yeah, bye.
Thank you so much.
Thank you.